Plan the coronal slices on the axial localizer and position the block horizontally across the liver as depicted. Verify the position in the other two planes. Establish an appropriate angle in the sagittal plane, aligning it vertically across the liver. Ensure that the slices adequately cover the entire liver, extending from the anterior abdominal wall to the erector spinae muscles.
Plan the axial slices on the coronal breath hold T1 images and position the block horizontally across the liver as shown. Verify the positioning in the other two planes. Establish an appropriate angle in the sagittal plane, aligning it horizontally across the liver. The slices must be sufficient to cover the entire liver from the diaphragm down to the C-loop of the duodenum. To prevent wraparound artifacts, phase oversampling, and in the case of 3D blocks, slice oversampling must be used. Instruct the patient to hold their breath during image acquisition. In our department, we typically ask patients to take 2 breaths in and out before instructing them to breathe in and hold.
Contrast administration and timing of scans. Guess timing technique. This is one of the simplest methods. It works by estimating the time it takes for contrast to travel from the site of injection to the vascular structures of the liver. This technique is highly dependent on factors such as the site of contrast injection, patient's age, cardiac output, and vascular anatomy. Generally, it takes about 18 to 25 seconds for the contrast to travel from the antecubital vein to the abdominal aorta, and 45 to 60 seconds to reach the portal veins. Therefore, the first acquisition of the dynamic sequence should begin within 20 seconds of contrast administration. Care bolus technique. The care bolus technique is the most commonly used method for bolus detection. This technique involves employing a coronal fast gradient refocused sequence to obtain real-time images every second through the vascular structure of interest, typically positioned over the heart. By monitoring the arrival of the contrast bolus in the heart, the operator can then switch to the centric 3D dynamic sequence for further imaging. Planning care bolus. Plan the coronal care bolus slice on the sagittal plane. Position the block over the mid-heart and angle the slice parallel to the ascending aorta. Verify the position in the other two planes. Determine the suitable angle in the axial plane, aligning it horizontally across the heart. To reduce artifacts caused by breathing and heart motion, utilize a saturation band on both sides of the block.
Introduction. MRI is one of the most useful and rapidly developing diagnostic tools for evaluating liver pathologies. MRI allows the acquisition of images with excellent tissue contrast and anatomical detail. It is particularly effective in visualizing liver tissue and can detect and characterize focal liver lesions. The success of liver imaging depends primarily on the technique and optimization of pulse sequences. Fast breath-hold T1 and T2 sequences with smaller slice thickness and high resolution are routinely used for liver imaging. Contrast-enhanced T1-weighted scans play a significant role in liver imaging due to their high sensitivity and specificity in detecting and characterizing focal hepatic lesions. Contrast agents for liver imaging. Intravenous contrast can enhance the sensitivity and specificity of MRI scans for lesion detection and characterization, as well as differentiate between benign and malignant liver masses. Contrast enhancement characteristics are frequently utilized for specific diagnosis of pathologies. Multiple contrast agents are accessible for liver imaging, including nonspecific extracellular contrast agents, hepatocyte-specific contrast agents, or a combination of both.